Hello everyone, welcome to Female Nature. This is your host, Victoria Chinenye Okoye. Thank you for joining us if this is your first time, and thank you for subscribing to support our channel. And if you haven't done so, please try and subscribe. That way you're helping the work we do. So today we will be looking at issues relating to fibroid if left untreated. If fibroids are left untreated, they can continue to grow, especially if the woman is still within the reproductive years of her life that's not nearing menopause. So they are likely to continue to grow because the level of estrogen in the body is still high. If fibroids are left untreated, they can put other organs like the bladder under pressure, and this will cause frequent urination, especially at night, and which will stop the woman from getting enough sleep. And we all know the effects of inadequate sleep in overall health. If fibroids are left untreated, they can also cause the fallopian tubes to block due to the size of the fibroids. They will just push the fallopian tube, and the fallopian tubes will narrow and maybe eventually block. And again, if there is excessive bleeding because of the fibroids, that can block the fallopian tubes as well. And we know issue, one major effect relating to fibroids if left untreated, and that is infertility. A lot of women are suffering not being able to conceive because of fibroids, because the space there in the stomach is not allowing anything else to stay. And again, if fibroids are not taken care of, they can cause miscarriage of the embryo because it does not have enough space in the womb to grow. So infertility, not being able to conceive, not being able to retain the pregnancy if the woman eventually manages to fall pregnant, these are the worrying and painful effects, the most worrying and painful effects of fibroids if left untreated. Every woman who has struggled with infertility and infertility relating to fibroids would tell you. An infertility of any sort, it is painful. And having miscarriages, it is such a pain that stays with a woman for the rest of her life. It is not a nice thing, physically and emotionally. So if people have fibroids, I suggest that any woman who has discomforting, frustrating, painful fibroids to get them sorted out. And fibroids, if left untreated, can cause pregnancy difficulties, because even if the woman manages to retain the pregnancy, she is likely to be bleeding. She will continue to bleed because the fibroid is interfering with the child that is in the womb. And this is a risk. Continuous bleeding is a risk for the mother and the baby. So it is not good if fibroids are left untreated, especially if they're big. If they're significant enough to cause discomfort, they need to be sorted out. And again, anemia, which relates to the loss of iron in the body. That is one effect of the fibroids if left untreated. Some people have had blood transfusion because they're losing so much blood, and maybe loss of blood likely caused by fibroids. So fibroids are not good. As long as they are significant, they are noticeable, please get them sorted out. And frequent bleeding, if a woman is having frequent bleeding because of fibroid, because fibroids can cause erratic period. The period, the woman sees her period now, after maybe a week or so, the period will come again. This regular bleeding, constant bleeding, can cause septicemia, which is sepsis, and sepsis, which is also blood poisoning. It can be a medical emergency. So it is important for people to pay attention if they have worrying symptoms of fibroids, to get the fibroids sorted out. And fibroids can cause bleeding when a woman is postmenopausal. So when the woman is not really having her period, she's gone into menopause and she's not supposed to be seeing her period anymore. And because of fibroids, she might be seeing blood, and that is a medical concern. So if a woman sees her period when she's gone into menopause, when she stopped seeing her period, she's gone beyond that age, but because she has fibroids in her stomach, she starts to see blood, she needs to consult her doctor. She needs to seek medical attention. And the big fibroids in the stomach, sometimes you see women, they look pregnant, they are so big, their tummy is so big, you think that they're pregnant and they are not. You can imagine the lack of confidence that the woman must be experiencing because of her physical appearance. Maybe her clothes don't fit, and she can't carry herself confidently because she is always looking pregnant when she's not. So these are the few effects of fibroids if left untreated. They are not nice. If the fibroids are tiny and small, they are not worrisome, then you can leave them alone, and the person may just carry on for the rest of their lives. And when they go into menopause, the fibroids might start to shrink, or they might remain stable without causing any problems. I suggest and advise every woman who has troublesome fibroids to please get them checked. Seek medical attention. I am not a medical practitioner myself. I can only advise you as a woman who has lived through, who has experienced fibroids and issues relating to fibroids for many years. So that's all we have time for today. Please subscribe if I haven't done so already. Please share the video and please like, and remember to make comments where we need improvement. Until then, until the next time, look after yourselves. Bye bye.